So what we had was an opportunity to really mobilize our resources to respond to the pandemic. We had research teams, we have experts here at Atrium Health, and how do we bring everybody together to actually join forces in addressing this disease?
I think what excites me the most about the research that we're doing right now is it's going to allow us to develop some tools and some skill sets in data science and artificial intelligence that we're going to be able to use in the future to help promote Atrium Health.
This trial is very important because it allows us to not only look at symptoms for persons in our community who may have been exposed or infected with the coronavirus, but also has the opportunity for participants to do antibody testing, which gives us another component to combine with the symptoms so that we can better understand how this pandemic has affected Atrium Health and the Charlotte community.
We've really been able to offer our patients cutting-edge therapy. We were the first healthcare system in the Charlotte Metro to gain access to remdesivir even prior to the FDA authorization. We were able to treat 190 patients with convalescent plasma before the FDA authorization for that as well. And we've been able to enroll patients in 4 other clinical trials we have opened through internal medicine and LCI, and 2 additional inpatient trials coming on board, all as good treatment options.
None of this outreach to our whole community would be possible without everyone coming together, going all in on thinking about vaccines for our future.
The orthopedic surgery department typically has conferences for the residents and fellows every morning of the week. And when the gathering restrictions for COVID-19 went into effect, the orthopedic surgery department completely reorganized our morning conference schedule for a virtual format. We realized pretty quickly that the virtual conferences not only were more convenient in some ways than in-person conferences, but also had the potential to allow for improvements in education that were not previously possible. And one of the benefits that we realized was that we could expand participation in our education conferences across multiple sites. In orthopedic trauma, there are many injuries and problems that can be treated in a variety of ways. Our thought was that we could we could all take turns sharing cases that might be controversial or have multiple possible treatment strategies. One of the most exciting possibilities leading from this new conference schedule is that we do not necessarily have to just limit it to Navicent, Wake, and Atrium. We could invite any institution that we want to across the country at very short notice even to these conferences and get even more interesting cases, more exposure for the residents to other institutions, and almost have impromptu grand rounds with guest speakers and new cases. So it's a great transition that I think we've made to being able to expand the education for our own residency program.
The PATH program was created for physicians, APPs, and teammates to get help for mental health needs, including medication management and psychotherapy. We originally created this so that we could just offer flexible, easy scheduling, but it turned into something much greater and much better than we could have ever anticipated.
And our healthcare workers were experiencing challenges they had never faced before, and for as much as we tried to prepare for things, we really couldn't prepare for something we didn't totally understand. We were seeing more depression, more anxiety, and more burnout associated with our healthcare workers, especially the people that were directly patient with.
Personally, I am inspired by the rapid response to meet the need. We saw the behavioral health service line collaborate at every level to make this a reality, and we continue to iterate and we continue to change and implement new services. The behavioral health service line, I think, is doing a great job of fighting stigma and decreasing barriers to care, increasing access, trying to promote resiliency in our teammates. And best of all, we have definitely achieved our goal of decreasing those barriers and increasing access because our target population, namely the physicians and APPs, has comprised 25 to 30% of all of our visits.
Research is an essential part of our For All mission at Atrium Health. As a learning health system, our researchers are redefining healthcare for our patients and our communities. Our Atrium teams are uniquely positioned to take research innovations from the bench to the bedside and scale them to our populations.
So sepsis has traditionally been considered an acute condition where early management has been prioritized. Only recently has there been more emphasis and increasing awareness on the post-discharge deficits that sepsis survivors encounter.
So we designed a clinical trial using a combination of rigorous methodology and a pragmatic approach to trial design to enroll over 4,000 patients in order to test the effectiveness of the STAR program.
Results from our project have the potential to shift the paradigm of post-sepsis care and improve outcomes for the millions of sepsis survivors annually.
A lot of the clinical expertise here at Atrium Health to treat patients with pancreatic and hepatic tumors revolves around the use of thermal ablation to destroy the tumors in situ. However, one of the problems associated with thermal ablation is damage to the underlying vasculature and ductal structures. The long-term goals of this project are to develop this technology toward clinical use. Doing so, we'll be able to offer our patients a treatment strategy that isn't currently available. And more importantly, we'll be able to treat patients that are not currently amenable to existing therapies.
The Surgical Critical Care Fellowship at Carolinas Medical Center is a one-year fellowship that trains surgeons to be intensivists in a fast-paced, interactive, and multidisciplinary team approach. The problem we were faced with the COVID-19 pandemic was one of our surgical critical care fellows was pregnant during her fellowship, and we had to restrict her from patient-facing activities. We had to identify a mechanism to allow her to complete her fellowship in a comprehensive and safe way.
There were two critical components to enable my success. The first was the technological setup in my home office, and the second was the team in the hospital.
The development of this new process is really exciting because we're able to potentially offer this to fellows that would not have this capability or this opportunity in the past. And with the growth of virtual care and telemedicine, this can be applicable to not only surgical critical care fellows, but many other training programs.
Virtual hospital are patients who could technically be on the floor at the hospital who are not acutely or critically ill and are safe enough to be at home. And then community paramedicine goes out to them, and then with me virtually or with a physician virtually can interact, get vitals, do labs, check their heart sounds, listen to their heart, do EKGs, any number of things that you could do on the floor.
We needed to organize providers, both inpatient, outpatient, subspecialty providers, in a time when we were rapidly getting information on how to manage these patients so that we could manage them at our highest level. I mean, I've been with the system for 10 years now, and I think with how large of a system we are, how innovative this was, how quick we put it up, and how nimbly we were able to manipulate the work to take care of these two different kinds of patient populations, to me was completely astounding.
It's made me really proud to be Atrium because we're doing something that is the most payer agnostic I've ever done, and I've only ever done underserved care in my entire career. And this is the most free and most giving I've felt as a physician in a very long time. And I'm looking forward to teaching that because there's nothing more rewarding than this.